Dr. Elbel, does it matter?
So we did some studies very similar to the Starbucks study you just heard about, and I think the basic story is it doesn't appear to change people's food purchases at a population level. People are seeing this information. When we did this work in New York after it rolled out, just over 50% of people are seeing it. Only about 10% of people say it actually mattered to them and influenced their food choices.
I'm actually not surprised by this because anecdotally, if you pay attention, if you're health conscious, if you pay attention to how many calories, you're not going to go near a Frappuccino anyway, and you're already going to know that it's high calories.
So I think we know that there's a subset of people for whom this information is really helpful. It probably is the people who already kind of pay attention to this stuff anyway. And for these people, they probably are making some changes. But is this going to be a solution to obesity from a population policy perspective? Probably not.
So healthy people make healthier choices. Do education or perhaps income level have an impact here?
Yeah, there is a little bit of evidence that both of those things matter, particularly in the Starbucks study and in some of our work as well. We did find that, if you know a little more, if you have a higher income, you can make different sets of choices. You have a higher education, there is some slight differences here. But even for sort of higher education, higher income groups, it's not the biggest predictor of their food choice.
And where do you see changes being made on the margin?
Yeah.
If we're going to cite anecdotal examples, I found myself at a Morton Steakhouse the other day, and I'm the kind of person who pretty much eats what he wants. But when I saw that the ribeye had 1,600 calories, I went for the veal chop at 650, surprising myself even.
Yeah,
that's a big change.
Eric's protecting his
it is a big change.
So what we found when we look at this work and also in the Starbucks study is people don't tend to make the change you made, right? They don't change the big thing they really came down for. They go for the 1,600. At Starbucks, they went for the big drink that they always liked before, but they did make changes at the margin in some of their food choices. So there is some differences there on the food side, not the core of what you tend to get at a Starbucks.
And as Julie alluded to, this is all part of the president's health care law, and it is set to take effect nationally. Starbucks is just getting a hit ahead of the issue. Is this going to happen? Do we know anything about when?
So it's going to happen any day now. We've been saying that for about a year. The FDA is working itself through this. They're getting several pushback from several industries, including, as you heard from Julie, the pizza industry and also the grocery industry. I think it'll happen eventually. It's part of the law. They have to do it eventually. And I think it could be different when it rolls out nationally and as this plays out more over time.
Is it possible, Brian, that a generational change is required for behavior to start taking effect? I think, for example, of people who are senior citizens right now who didn't grow up with the internet.
Sure.
Not a lot of them. Well, there are some who use it, but it's not like everybody's gravitated towards web surfing all the time and Netflix and that kind of thing. But talk to their children or talk to their grandchildren, and they're doing it. So maybe it's just a matter of time before people figure out that they are valuable choices that they could be making with the additional information?
Sure. So I think a generational change is going to have to be part of it. We know that, once you're at a higher level of obesity, it's really hard to make those changes. And so if you can get kids earlier, it's really important. I think the other thing that's going to be really influential is not looking for these one-shot silver bullet solutions like calorie labeling. It's going to take lots of different things that come together, lots of policies and approaches, and have that play out over time.
So what's your best advice for a company, a burger joint, a Morton Steakhouse, given all of this data that you've collected and what we know is soon to be law?
So I think that you are seeing places like Starbucks and previously McDonald's who are doing this voluntarily. I think many of these organizations know that this is coming down the road. They're going to have to do it soon. And so, we're sitting here talking about Starbucks doing it voluntarily, and we wouldn't be if they did it when the law passed and everyone had to.